Have you ever dismissed the discomfort of a urinary tract infection, thinking it will just go away on its own? What if I told you that ignoring the warning signs could lead to something as severe as kidney damage? Yes, those minor symptoms can be the precursor to major health issues. Urinary tract infections, or UTIs, are not just a common annoyance. They are a widespread health problem that affects millions globally every year. Often, we underestimate their potential to escalate into more serious conditions. A UTI begins simply enough, typically when bacteria enter the urinary tract. This can cause symptoms like a burning sensation during urination, an urgent need to urinate, and even lower abdominal pain. While these symptoms might seem manageable with home remedies or over-the-counter treatments, the real danger lies in what happens if they're not adequately addressed. Today, we'll dive into the hidden dangers of UTIs and uncover why something as commonplace as a urinary tract infection can become a dire threat to your kidneys. It's a journey through your body's warning signals, the risks of neglect, and the steps you can take to protect one of your most vital organs. Stay tuned as we explore the deeper implications of this often overlooked health issue. A urinary tract infection, or UTI, is an infection that occurs anywhere along the urinary tract, which includes the kidneys, ureters, bladder, and urethra. Most commonly, UTIs are caused by bacteria that enter the urethra and then move up to the bladder, where they multiply and cause an infection. Although bacteria are the most common cause, fungi and viruses can also cause UTIs, but these are much less frequent. The infection typically starts when bacteria from the digestive tract, such as E. coli, cling to the opening of the urethra and begin to multiply. Women are particularly prone to these infections due to their shorter urethra, which allows bacteria quick access to the bladder. Additionally, sexual activity, certain types of birth control, and menopause are factors that can increase the risk of developing a UTI. The symptoms of a UTI can vary depending on the severity and the part of the urinary tract that is infected. Common symptoms include a strong, persistent urge to urinate, a burning sensation when urinating, passing frequent small amounts of urine, urine that appears cloudy, urine that appears red, bright pink, or cola-colored, a sign of blood in the urine, strong-smelling urine, pelvic pain, especially in the center of the pelvis and around the area of the pubic bone. Urinary tract infections are one of the most common bacterial infections affecting millions of people each year worldwide. They are especially prevalent among women, with approximately 50–60% of women experiencing a UTI at some point in their lives. The incidence is so high in women due to the anatomical differences in the female urinary tract. Research also shows that about 1 in 5 young women who have a UTI will have another, and 30% of those who have had 2 will have a third. Among seniors, UTIs are the second most common type of infection, presenting a significant health concern in elderly populations. A urinary tract infection typically begins in the lower urinary tract, which includes the urethra and bladder. In its initial stages, the infection is called cystitis, an inflammation of the bladder usually caused by bacteria such as E. coli. If a UTI is left untreated or if the bacteria are particularly aggressive, the bacteria can travel up from the bladder through the ureters, which are the tubes connecting the bladder to the kidneys. Once the bacteria reach the kidneys, the condition escalates to what is known as pyelonephritis, or a kidney infection. This type of UTI is more severe and can cause significant damage to the kidneys if not promptly treated. Several conditions can increase the risk of a UTI progressing from the bladder to the kidneys, making the infection more dangerous and difficult to treat. Blocked urinary flow, any obstruction in the urinary tract, such as kidney stones or an enlarged prostate, can block the flow of urine. This makes it harder to flush out bacteria from the urinary system, increasing the risk of any infection reaching the kidneys. Weakened immune system. Individuals with weakened immune systems, whether due to illnesses like diabetes, HIV/AIDS, or treatments like chemotherapy, are more susceptible to infections. A compromised immune system can make it difficult for the body to fight off the initial UTI, allowing it to spread to the kidneys. Catheter use. The use of urinary catheters for a prolonged period can also increase the risk of developing a UTI that can move to the kidneys. Catheters can introduce bacteria into the urinary tract and are often used in patients who are hospitalized or have mobility issues. Pregnancy. During pregnancy, hormonal changes and physical shifts in the position of the urinary tract can slow urine flow and increase the risk of infections, including those that can ascend to the kidneys. Previous UTIs. Individuals who have had UTIs previously, especially if they have had kidney infections, are at a higher risk of subsequent infections reaching the kidneys. Understanding and mitigating these risk factors is crucial for preventing the progression of UTIs from the bladder to the kidneys and maintaining overall urinary tract health. Pyelonephritis is a type of kidney infection that results from a urinary tract infection, UTI, that has ascended from the bladder to one or both kidneys. This serious medical condition can occur rapidly, acute pyelonephritis, or as a slow-developing, recurring condition, chronic pyelonephritis. Symptoms of acute pyelonephritis can be severe and include high fever and chills, severe flank pain on one or both sides of the back, nausea and vomiting, painful urination, frequent urge to urinate, cloudy or bloody urine. These symptoms occur as the body tries to fight off the bacterial infection that has reached the kidneys, causing inflammation and pain. If kidney infections are recurrent or a single episode is not effectively treated, it can lead to chronic kidney disease, CKD. Chronic kidney infections can cause scarring and damage to the kidneys, reducing their ability to filter blood effectively. Over time, this scarring can lead to reduced kidney function and eventually kidney failure, requiring dialysis or kidney transplantation. Chronic kidney disease may develop without overt symptoms initially, making it crucial to manage and treat any UTI promptly to prevent its progression. One of the most severe complications of a UTI, including pyelonephritis, is the development of sepsis, where the infection spreads into the bloodstream. Sepsis is a potentially life-threatening condition that can lead to shock and organ failure. Symptoms of sepsis include a rapid heart rate, decreased blood pressure, high or abnormally low body temperature, confusion or delirium, difficulty breathing, extreme pain or discomfort. Early recognition and aggressive treatment are crucial for managing sepsis, typically involving antibiotics and supportive care in a hospital setting. The progression of a UTI to severe kidney complications or systemic infection highlights the importance of recognizing UTI symptoms early, seeking prompt medical treatment, and adhering to prescribed treatment plans to prevent these serious health issues. Preventing urinary tract infections primarily involves lifestyle and hygiene practices that help keep bacteria at bay. Here are several effective strategies. Stay hydrated. Drinking plenty of fluids, especially water, helps dilute your urine and ensures that you'll urinate more frequently, allowing bacteria to be flushed from your urinary tract before an infection can begin. Practice proper hygiene. For women, wiping from front to back after using the toilet prevents bacteria from the anal region from spreading to the vagina and urethra. Both men and women should keep the genital area clean and dry. Urinate when needed. Avoid holding urine for long periods. Urinating when the need arises helps remove bacteria from the urinary tract, reducing the risk of infection. Cranberry products. Some studies suggest that cranberry juice and cranberry supplements may reduce the risk of UTIs by preventing bacteria from adhering to the urinary tract walls. Safe sexual practices. Urinate before and after sexual activity to flush out bacteria. Additionally, using barrier contraceptives like condoms can help prevent UTIs. Consider probiotics. These beneficial bacteria, particularly those found in fermented foods or supplements, can help maintain a healthy balance of bacteria in your body and may reduce the risk of UTIs. The primary treatment for UTIs is antibiotics, which are effective at clearing the infection. The type and duration of antibiotic treatment may vary depending on the severity of the infection and whether it is complicated or uncomplicated. Antibiotics. For uncomplicated UTIs, short courses, typically 3 to 5 days, of antibiotics are usually effective. Commonly prescribed antibiotics include trimethoprim sulfamethoxazole, nitrofurantoin, and fosfomycin. Pain relief. Over-the-counter pain relievers may be used to alleviate symptoms such as pain and burning during urination. Phenazopyridine, for example, can be used to ease discomfort, but it does not treat the infection itself. Follow the prescribed course. It is crucial to complete the full course of prescribed antibiotics even if symptoms improve, to ensure that the infection is fully eradicated and to prevent resistance to antibiotics. Prompt medical attention can prevent most UTIs from becoming serious. You should see a doctor if you experience symptoms of a UTI, such as persistent urge to urinate, pain and burning with urination, frequent urination with little output, cloudy, dark, bloody or strange-smelling urine, fever or chills suggesting the infection may have reached the kidneys. For individuals with recurring UTIs, unusual symptoms, or pre-existing health conditions that may complicate a UTI, it's especially important to consult healthcare providers. They may suggest more extensive treatment options or investigate for underlying abnormalities contributing to recurrent infections. Today, we've explored the critical nature of urinary tract infections, UTIs, and their potential to cause severe complications, including kidney damage. If you experience any symptoms of a UTI, it's essential to take them seriously and seek medical advice promptly. Early intervention is key to preventing serious complications and maintaining good kidney health. Remember, vigilance about your health is crucial. Recognizing and responding to the signs of a UTI can protect not just your urinary tract, but also your overall well-being. Have you or someone you know ever experienced a UTI that led to more serious health issues? Share your experiences in the comments below. Your story could help others recognize the importance of addressing UTI symptoms early. For more informative content on how to keep yourself healthy and aware of potential health risks, don't forget to subscribe to our channel and follow us for updates. Stay informed and stay healthy.